High blood pressure is a condition characterized by consistently high blood pressure on the arterial walls. It's high when greater than or equal to 130 over 80 millimeters Hg. If the pressure reaches 180 over 120 millimeters Hg, medical attention should definitely be taken. While genetics plays a role, unhealthy lifestyle habits such as diet, including high sodium, lack of physical activity, and age, contribute significantly. Anatomically, it is almost always due to the accumulation of atheromatous plaques obstructing blood vessels, or to the rigidity of the vascular walls. According to the laws of fluid dynamics, things happen similar to the pressure of a water jet from a garden hose, which increases when it is constricted or when its walls have become rigid. High blood pressure is dangerous because not only does it silently destroy without showing any outward signs, and this for several years, but above all, it will inevitably damage the vessels of the heart, brain, kidneys, and other organs, thus increasing the risk of heart attack, stroke, and other health problems. Why is it important to have it checked? Many people with high blood pressure have no symptoms. Regular checkups are therefore essential for early detection and treatment. Important reminder: call 911 or any other emergency service in your area if your blood pressure is higher than 180 over 120 and you experience chest pain, shortness of breath, back pain, numbness, weakness, altered vision, or slurred speech. Thank you for following us, and see you at the next definition. Obesity is a chronic and complex disease characterized by excessive body fat accumulation that can significantly impact overall health and well-being, typically defined by a body mass index, BMI, of 30 or higher. Normal BMI is under 25, while overweight status has a BMI between 25 and 29.9. Obesity is broadly classified into 3 different classes, with Class 1 being a BMI between 30 and 34.9. Class 2, 35 and 39.9, and Class 3, 40 or greater. Obesity need to be monitored. Note: very recently, 75 global health organizations were requesting health professionals to consider more than just BMI before concluding to obesity. Example, consider waist circumference and fat distribution. Diabetes is a chronic disease where the body either doesn't produce enough insulin or can't effectively use the insulin it produces. Insulin is a hormone that helps glucose, sugar, get into cells for energy. High blood sugar or hyperglycemia is a common result of uncontrolled diabetes, and over time, it can damage various systems, especially nerves and blood vessels. For individuals without diabetes, a normal fasting blood sugar level is below 100 milligrams per deciliter. For people with diabetes, the target blood sugar level before meals is generally 80 to 130 milligrams per deciliter. For both, within 1 to 2 hours after a meal, it should be less than 180 milligrams per deciliter. Symptoms: increased thirst, frequent urination, weight loss without trying, fatigue, slow healing sores, blurred vision. Heart diseases are the leading cause of death in the U.S., affecting millions of people. The term heart disease refers to a broad range of conditions that affect the heart, including problems with its structure, function, or blood vessels. These conditions can disrupt the heart's ability to pump blood effectively, leading to a variety of symptoms and complications. Under heart disease name, we can list various conditions like coronary artery disease, heart failure and arrhythmias, valve disease, and some congenital heart disease. Following symptoms may be seen: chest pain or discomfort, shortness of breath, swelling in the legs, ankles, or feet, fatigue, irregular heartbeat, dizziness or fainting, etc. A heart attack, or myocardial infarction, is a circulatory problem caused by a blockage of a vessel that supplies the heart. A heart attack can be predicted due to warning signs, including chest pain. Cardiac arrest, on the other hand, is caused by an electrical malfunction of the heart's rhythm. It often occurs very suddenly, with no warning signs even in apparently healthy people. However, heart patients are most susceptible. The prognosis for cardiac arrest is very poor. After 5 minutes of cardiac arrest, survival is around 7 to 8%. After 10 minutes, it is close to zero. A stroke or cerebral infarction is a sudden loss of one or more brain functions due to a sudden interruption of blood flow in the brain. It is often caused by an artery blocked by a clot or a blood vessel rupturing. There are 3 types: hemorrhagic, ischemic, and transient ischemic attack. In general, ischemic strokes are more favorable than hemorrhagic stroke, but variable depending on severity. The treatment is essentially medical. Arthritis is a term for conditions that cause joint pain, stiffness, and inflammation, which typically worsen with age. The 2 main types of arthritis are osteoarthritis and rheumatoid arthritis. They damage joints in distinct ways. Osteoarthritis is the most common type, resulting from wear and tear on cartilage, the cushion between bones. Rheumatoid arthritis is the type where the body's immune system attacks the joint linings, causing inflammation and potentially destroying cartilage and bone. In summary, while osteoarthritis and rheumatoid arthritis are the most common, other types like gout, ankylosing spondylitis, psoriatic arthritis, and juvenile arthritis exist as well. Chronic kidney disease, also called chronic kidney failure, involves a gradual loss of kidney function. Normally, your kidneys filter wastes and excess fluids from your blood, which are then removed in your urine. In the chronic kidney disease, your kidneys are damaged and can't filter blood the way they should. In conclusion, it is a progressive, long-term condition where the kidneys lose their ability to filter waste and excess fluid from the blood effectively. It's characterized by a slow decline in kidney function over several years. If associated with diabetes or high blood pressure, the patient is at a greater risk. Cancer is a genetic disease where cells grow and divide uncontrollably, violating their normal boundaries and spreading to other parts of the body. It's a large group of diseases, not just one, and is characterized by uncontrolled cell growth and division. There are various types of cancer classified by the tissue or organ where they originate, or by the type of cell they affect. Types of cancer. Carcinoma originates in the skin or tissues lining internal organs. Sarcoma develops in connective tissues like bones, muscles, cartilage, and blood vessels. Leukemia affects blood-forming tissues such as the bone marrow, leading to the production of abnormal blood cells. Lymphoma and myeloma start in cells of the immune system. Other types. There are many other specific types of cancer, such as breast cancer, lung cancer, prostate cancer, and colorectal cancer. Erectile dysfunction is the inability to achieve and maintain an erection that is firm and lasts long enough for satisfactory intercourse. There are 2 categories: primary erectile dysfunction, when a man has never experienced an erection, and secondary erectile dysfunction, when it appears at some point in life. Among secondary dysfunctions, we distinguish firstly sexual impotence, which is the difficulty in achieving and maintaining a sufficiently firm erection. Secondly, we have premature ejaculation. And thirdly, we have priapism, which is a prolonged, often painful, pathological erection occurring without sexual arousal. Parkinson's disease is a chronic condition characterized by the progressive destruction of certain dopaminergic neurons in the part of brain essential for movement control. The resulting dopamine deficiency disrupts the balanced establishment of movement, leading to characteristic symptoms such as tremors, rigidity, and slowed movement. Parkinson's disease progresses slowly through 4 successive stages. The mortality rate for Parkinson's patients is twice as high as that of healthy individuals of similar age and sex. A sign and a symptom are the same thing. They are a feeling felt or experienced by a person who comes to see a doctor for a consultation. It is different from an illness. A sign has 2 components, subjective and objective. It is subjective because it is reported by the person experiencing it as they feel it. It becomes objective or objectified when, during the physical examination, the physician highlights it, particularly through touch or certain techniques. For example, a fever can be detected by a thermometer, weight loss by weighing, respiratory problems by auscultation, pain by touch, etc. A syndrome is a set of symptoms that occur simultaneously and characterize a particular disease. Syndromes do not necessarily have a single known cause, and their symptoms can vary. For example, fever, weight loss, cough, fatigue, lack of appetite, night sweats, etc. may simultaneously suggest tuberculosis. Diagnosis is, at first, a disease that the doctor is thinking of in presence of signs or syndrome. Note that I say think of because this diagnosis must then be confirmed or refuted later on. In other words, the diagnosis has two successive components. The first is presumption or exclusion, for which the doctor will order laboratory tests and imaging. The second component will be confirmation upon return of the requested results. In our example, the presumptive diagnosis would be tuberculosis until lab tests and imaging confirm it. The disease. Once the results confirm it, we will then speak of a disease, an illness, a condition, or simply a confirmed diagnosis. So, for our example, the disease here will be tuberculosis. Thank you, and see you at the next definition. The words infection and inflammation are often used together, but their meanings are very different. Infection is the invasion of the body by a pathogen that multiplies there, while inflammation is the body's response to protect itself from infection. Inflammation is a response from our immune system when our tissues, skin, muscles, joints, mucous membranes, etc. are damaged. Our body detects any kind of aggression or invasion, including an infection, injury, or irritant, and attempts to eliminate harmful substances and repair the damage. Inflammation is the starting point of the fight. Infection refers to the invasion and multiplication of microorganisms in our bodies. These primarily refer to microbes, but can also include viruses, parasites, and biochemical toxins. An infection can cause inflammation. However, inflammation can never cause or lead to an infection. In other words, infection is bad because it attacks us, while inflammation is good because it defends us. The main manifestations of inflammation from a local perspective are pain, redness, swelling, and heat. Some schools add functional impairment. Generally speaking, fever is considered a sign of inflammation. Thank you for following us, and see you at the next definition. Alzheimer's disease is a neurodegenerative disorder characterized by progressive and irreversible damage to the brain's nerve cells. It primarily affects memory, but also other cognitive functions such as language, reasoning, and learning. The loss is slow but inexorable, generally progressing to a loss of independence. Short-term memory is the first to be affected. The affected person loses the ability to process multiple pieces of information at once. They need to make lists, navigate a calendar. They no longer know whether they've paid their bills, etc. Then the disease gradually spreads to the entire brain. Older memories, however, are retained for longer.